Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, if you've been watching this show, we focus each week on a different healthcare professional or service or program offered here by KRMC. These programs will be of interest to you and your family about healthcare matters. So stay tuned, we'll be back right after these messages with an exciting guest. Welcome back to Your Health Matters. My guest today is Kurt Manley. He's a physician's assistant, correct? PA.
Yes, I am. I am.
So that's cool, and I appreciate you being on the show today.
You're very welcome.
I'm
going to enjoy this.
Well, and before we go into, because you have multi-jobs now.
Yeah, I do.
Before we do that, let's talk about Kurt for a minute, for those few folks that might not know you, because you're a longtime Kingmanite.
I am, with a break in there. I mean, I grew up here. I graduated from Kingman High School in '79, and I'm proud of that. But
Absolutely.
And then I joined the Navy, where I stayed for 26 years.
Wow.
And then after I retired, I was living in San Diego, Sacramento, and thinking, I'm okay with this. And
yeah, San Diego's not too bad a place.
No.
A lot of people.
Yeah, and a lot of high prices too.
Yeah.
But yeah, you pay for that beautiful weather and all that
Yes,
wonderfulness.
you do.
So
Yeah. So when did you come back to Kingman?
Dora and I moved back here in 2009.
Okay.
Which is I got an opportunity to come back here that I never thought I would. And the irony is that I started at KRMC when I was, I guess, a freshman in high school as a candy striper.
You did?
Yes.
Did they have candy stripers
They
back
did.
then?
I was the first guy to ever be a candy striper, and
I
they
did not know that.
They had to have one of the ladies did seamstressing, and she made me one of the
pink and white shirt.
Pink and white shirts, and I wore it. Yeah, I couldn't wear the dress. Yeah,
I did not know that.
Yeah.
See, every time I do this show, I learn something new.
Yeah, that's cool.
Either about my guest or the service, whatever. It's educational for me too.
Yeah, so there you go.
So you were, I was a candy striper, not here in Kingman, back in Minnesota, but that was my one and only healthcare experience until I started KRMC. So.
You know, and it was the shade the direction that my career went. I had some really great people that took care of me. There was a couple of nursing assistants, one was a guy by the name of Bill Giesing, another one by the name of Mike Stone. And then, of course, Dr. Lingenfelter. They just kind of took me under their wing and just said, here, let's do this. This is the way to go. And it was just, it's just a fun experience to, you know, and I got the chance to say thank you to Dr. Lingenfelter one time, and it was priceless. It was truly the most priceless moment.
He is such an amazing man.
Yeah, he really was.
What a gift to our community he was. So that candy striper experience kind of were you interested in medicine before that?
I didn't, no, not before that. I did it, it was kind of a, yeah, okay, that sounds kind of cool. And then I'll see what happens. And then one thing led to another, and then the interest struck because of those people. They kind of, you know, and then there was a registered nurse by the name of Mary Ann Matisic, who's still in the area, and she started showing me stuff and started guiding me also, and it was, I thought, do I want to go nursing? And Dr. Lingenfelter said, no, you don't. You really don't. And he says, you want to go in a different direction. You want to go to medical school.
Okay.
And so I thought, okay, well, this sounds like really good. And I wasn't the best student to get in a scholarship wasn't going to be my best choices. Yeah. And then the military was, the Navy provided an opportunity, and so I said, oh, okay, this is what I'll do.
So that's where you got your medical training?
Yes.
And education was while you were in the Navy?
I was, and the Navy sent me to their program, which was down in San Antonio, and then I did my, all my rotations at the Naval Hospital in San Diego.
That's pretty sweet. Yeah. That's pretty sweet. And then, so you were a corpsman then in the Navy? I was,
and I made it through the rank of chief.
Well,
and then after I was in the right place at the right time, so I made chief very fast. And I thought, okay, now what am I going to do for the rest of my career? Because at the time, PA school had been stopped by the military. They weren't doing the school anymore. And then, so I started doing all my stuff to do it after I retired. And then they went back online and they brought it in, and
so they did before you got out? You were able to get the PA
program. I was.
Oh, very
got my commission, paid them back, and retired as a lieutenant.
Excellent.
So,
very good.
Very happy about that.
Very good. Super. And then we got blessed and got you here.
Yeah.
We're so
Thank
lucky.
you very much.
Well, so when you retired from the military, you were in San Diego. Did you work as a PA in San Diego outside?
I worked, prior to my retirement, there was me and there was another doctor that was there. There was my commanding officer while I was in my last tour of duty, and he was putting together what's known as the deployment health clinic. And basically all we did was work with guys with PTSD and all of the traumatic brain injuries from people coming back from deployment. And unfortunately there was a big need for it. So the military did the right thing and they were setting these clinics up, and him and I were responsible for setting up the one in San Diego. And we did it as the end of he retired about 6 months after I did. And so basically what it was is that we both stepped out of that from, like, basically on Friday it was captain and lieutenant to Dr. Sovich and Mr. Manley. You know, it went that well, so I did that for a while. But it was hard, I mean, from a mental standpoint. And I had a kid that used to work for me that he came back from a deployment, and he was just a shell of the kid that I used to know, and I said, I can't do it anymore. It was terrible. I couldn't. And so then an opportunity presented me to go to family practice up in Sacramento, which is what I went down.
Oh, okay. So then you went from San Diego to Sacramento.
I did.
For Kingman.
Right.
Okay.
And then brief stop there, and then just kind of getting settled into Sacramento, and this position opened up.
Right. And that was with Fast Track.
It was with Fast Tracks.
Fast Track, the original before KRMC.
Right.
So you came back with the original Fast Tracks.
Right.
And then you got really lucky, and KRMC bought him.
Right.
And you got to come to work
right.
with us.
I did. I did. That did actually work out really well because, you know, it's just like, wow, this is really nice. I can deal with this.
Yeah.
So yeah, it did work out.
So you worked at the Fast Tracks, both the one on Beale Street and then on Stockton Hill Road.
And then I worked at. I had started there, and in fact I had gone to the grand opening, and I thought, wow, this is a really nice clinic. And I come down to help Dora out at the time, and just give her some hands, and it was, wow, this is a really nice clinic, and it was a beautiful clinic.
The one on Beale Street.
On the one on Beale Street, right. And then they moved out to the one out in Golden Valley, and I worked out there. I work out there primarily now, but but then the one on Stockton Hill.
Right. So let's talk about Fast Tracks a little bit, because I don't know if people really understand what Fast Tracks does and what it's there for them.
Well, you know, one of the biggest things that it really provides a service from the standpoint of primary care doctors are so busy.
Oh, I know.
And
the
so,
ER too,
right. I mean, and nobody wants to go. They go, okay, well, I can't get in my primary. Oh my God, I don't want to go wait, you know, 3, 4, 5, 6 hours at the emergency room.
Right.
So Fast Tracks, I mean, urgent cares in general, that's what they're designed for. Because if you come in and you wake up and you go, oh my God, I'm so sick. And, well, I can't get in my primary care for 2 weeks. Well, I'll either be better or dead by then.
Right.
So,
if I want to get help, I need to find something.
Right, I need it now. And so that works really well. Or, you know, you've got those minor surgical procedures, you know, you get a little cut or something to that effect. Or, you know, one of the biggest things.
Bite,
right,
kind of
things that you know, simple little infections, and you know, it's the confusion is that we're not primary care. That's the biggest thing, and you know, and I think that urgent cares in general provide a really great service, and Fast Tracks is open a ton of hours.
Right.
I mean, it's from
Weekends
8, every day we are open, even holidays, Christmas, New Year's, we're always open. And that's good, because that's, you know, people, I mean, it doesn't take, like, sickness doesn't take a holiday.
Right,
You know,
that's
so if
true.
you're not feeling
In fact,
well.
it usually is on a weekend or a holiday when you get sick. And you're
right,
like,
you go, now what am I going to do?
Yeah.
Right. And I think the urgent care in general provides a really great service. And there's some great people, they've got a great staff.
That's awesome.
So.
Well, and it truly, it helps the ER as well.
It does.
Because then people have someplace else to go for those minor things that if we didn't have a Fast Tracks urgent care, we'd be bottlenecking more in the ER, right?
Exactly. I mean, again, I mean, it's, you know, if a patient has a urinary tract infection, they don't want to sit for 8 hours and take up a bed that, unfortunately, the ER needs for something else.
Right.
And so, but it's just as important to that patient as it is the guy that's over there bleeding. So, but it's perfect to come to Fast Track, because we can usually get them in and out fairly quickly.
Now, when you said you're not primary care, but you are kind of, aren't you? I mean,
in a sort of kind of way. We're not going to monitor we're going to, you know, if you come in and you got high blood pressure, we're going to take care of it today, but you need to follow up with the person to follow and get all the labs and get the things that you need.
So people aren't going to say, oh, my doctor's Kurt Manley.
Right, right. Who's your primary care? Well, Kurt is. Well, no, I'm not. But, well, I might be, but not now. I'm not at Fast Tracks.
Right.
So, and that's where the difference lies in as far as what you need to do. So.
That's good to know. And I think it is important that people realize, number one, we have 2 locations, the one in Golden Valley, so that's great for the folks out that end.
Right, which was the design and purpose and what it was going to be for.
Yeah.
And then we have the one over here on Stockton Hill. That was the original, and that was when it was first opened, and it's busy all the time. But again, with the staff we have, we get them in and get them out, and that's, what we decide.
Super. Well,
Right.
and like we talked about, it is for those, if you've got an earache or a sore throat and things like
Right.
that, and you really, like you said, you don't want to go sit in the ER and have to
Right.
wait, or not even if you have to wait. I mean, our ER is pretty good. We try to get people in and out of there pretty fast, but you really don't want to
It's a hit and miss.
Yeah.
But
it
Friday
is.
night, forget it.
Right.
I mean,
Yeah. Friday and
but-
Saturday nights are not good times to go to
Right.
the ER.
But and Fast Track also provides a service like when we do school physicals or sports physicals,
Oh.
we can do those very quickly too.
That's good. I forgot. I'm glad that you
Right.
reminded me of that, because
So.
that is good for them.
Right,
to
and
know.
and again, in August is one of those times. We'll probably see 60, 70 patients a day, but 40 or 50 of them are going to be school physicals. So
Oh, wow.
that's
Okay.
so if you walk into the room and it's like, oh no, I don't want to be here for that.
Yeah.
But it's not going to take that long. It's
That's
just the
good.
physicals.
Okay.
So
And like flu shots and things like that?
still
do you
doing.
give
We started doing
those?
flu shots.
Okay.
And you can come in and get that done and fairly quickly.
Okay.
Again, so.
Well, and then, besides doing fast tracks, now you're also working for Dr. Kevin Brown.
I am. That opportunity. His PA took a position out of state, and the position opened up, and I had talked to the powers that be, and they said, well, we can start you off there as a part-time thing, but I went, great. And I love family practice because I get the chance to sit down, and unfortunately in Fast Track, which is another thing, you don't get the chance. I mean,
I really have build that relationship.
Right. Unfortunately, as a patient comes in for an ankle sprain, I'm going to take a look at the ankle, get that fixed, and then have a nice day. And unfortunately, they go on. But
might see it Safeway or Walmart, but
right, exactly. But at family practice, you just get to sit and talk and get to know that patient and get to know who they are. And it's the patients will come in and they're not really sick. This lady had unfortunately just lost her husband of 50 plus years, and she just needed somebody to talk to.
Oh.
She needed her beds refilled,
Yeah,
but that
right.
takes, that doesn't take very long.
Right.
Everything's fine, she's stable.
Yeah.
But we just talked for like 30 minutes.
Awesome.
And that to me there's nothing better. That's a part of medicine that they can't teach in school, and I was,
True.
I learned that over the years, and it's just, and I really enjoy it. And to be real honest, Dr. Brown is just fun to work with.
Yeah.
He really is.
He's a character.
He really is.
I've been trying to get him on the show, so maybe now that you've been out, you'll be able to tell him, hey,
I'll go talk to him.
Doc, it's not
I'll
that
go talk to
bad.
him. Yeah, it's not bad. It really isn't. We have a lot of fun.
Well,
with that.
because you guys are doing, I know you're doing family practice, but then he's kind of specializing in hormone replacement
Right.
therapy too.
And
And
he
I
does,
know
and-
there's lots of women and guys out there
Yeah,
that
they
could
need
use
that,
help
and
with
and he provides a great service because he has this comprehensive review of all of your labs, and then he puts you on, and then he monitors very closely because with a lot of those, you just need to just jump them up a little bit here or drop them back a little bit there, and it's a great part of it.
Yeah,
So
so that's super. Okay.
Yeah.
So you're enjoying being with Dr. Brown?
I do.
Yeah.
I do. Great staff.
Awesome, awesome. So is that maybe going to work into full-time eventually?
You know,
then?
I
Or are you going to keep
I'd
going?
hope that it does. I hope that it goes that direction. But the reality is that Fast Track still needs the other providers. And there's other providers out there that are looking that direction. But I'm not sure where that's going to go. But I'm kind of hoping that the family practice thing comes to
Good.
fruition
Yeah.
because I do really enjoy it.
That's great.
So
physician's assistant, though, is different than a doctor, and it's different than a nurse practitioner.
right.
So let's
So
talk
our
about
biggest
that.
thing in the, there was a great article in the Washington Post that explained it differently and how, but the reality is that physician's assistant and nurse practitioners can pretty much do everything that they can each do. You can prescribe medications. The difference is that nurse practitioners are sole practitioners, and they are trained in a nursing model, whereas a physician assistant is trained in a medical model. And we have to work under the license of a physician, an MD or a DO, as that would be.
Okay.
So.
Well, we're going to take a quick break, and then we'll come back and maybe we can talk about that a little bit more.
Okay.
And then all the other fun things you're doing.
Okay.
Okay. So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Kurt Manley, physician's assistant and Kingmanite. We were talking about that. I forgot, though, earlier in the show, I was going to ask you about that bulldog thing. You were sharing that on Earl's show, you've talked about that, but...
I was in my senior year in high school. They came out with the bulldog, whose name at the time was Bowser.
Bowser the
Bowser,
bulldog.
right?
What is it now? Did they change it?
They did, and I don't remember what it is now.
Bully the Bulldog? I don't know either.
Dylan told me, and he was very proud of it, and I don't remember what it is. But anyway, so I tried out for it because I wasn't really athletic then or now, but especially not then. And so I thought it would be fun, because it was going to be different. And so I tried out, and I'm not sure if I got it because I was the only guy or because I could, touch my legs out, toes out at the jump up in the air.
Oh, you got to.
I did then. Oh. Then it makes my hips hurt to think about it now. So I was the very first Kingman High School Bulldog, which I was, and I was amazed at the number of people that, right, exactly, and the number of people that remember that. And I'm going, really? Wow, I didn't know that.
You must have made a bark.
I did. I just did something.
Yeah, that's pretty cool.
And the things that people remember that,
it's the first Bulldog.
I know. I'll get a picture and sign it for you.
Okay, good. You sign it as Bowser the Bulldog?
You bet. You bet.
AKA Kurt Manley.
Right, yeah, that way you know exactly. That way when you're going through your stuff, you go, who is this?
Who, what? Yeah. Okay, so anyway, we got sidetracked there, but physician's assistant, we were talking before the break about what a physician's assistant is compared to a nurse practitioner and a doctor. Right. So let's talk about that a little bit more.
Well, physician's assistant was one of those that started out in the late 60s, and it was through Duke University, and they were very first class was all prior Navy corpsmen. Oh. And that's where it started. And so the idea was that they were going to supplement the family practice primary care type situation, which is...
Because there's a shortage?
There was a shortage then, and there's a shortage now.
Yeah.
Right, and so it works along that way. So now, but then there's so many more that just specialize, orthopedics, emergency medicine, any number of things, dermatology.
So as a PA, you can specialize in one of those.
Right, and there's just recent changes that give us that qualification that you can take the board, you can be board certified in those different specialties if that's the direction that you want to go. And same with surgical specialties.
So would a patient call to make an appointment with the PA, or would they call to make an appointment with the primary doctor and then...
Kind of goes either way. I mean, in our situation, Dr. Brown has this huge following. So they'll come in and they'll say, okay, I can get you in today with our PA, Kurt, or you can wait till next week when he's available.
Right.
And they'll, and depending upon what it's for, they'll say, no, I'll see Kurt. And I'm going to give them the same care that he gives.
Sure.
And then I can prescribe the same medications. And he reviews my charts, and we discuss all of our patients and things like that.
So yeah. But that's kind of cool because, again, like we were talking about earlier in the urgent care, it's like they can get in to see you faster than they could.
Well, a classic example, if I'm seeing a patient, and I said, and a common response is, I don't have a primary care. They just have, and for the most people, they just don't. And I said, well, okay, well, call this office and make an appointment to see me there, and I can follow up. Well, that makes it easier if that happens, which it has sometimes, but it doesn't happen all the time.
Sure.
So so they can call and they can ask specifically to see me, or they'll say, "What's the first available?" I don't care who I see.
Yeah.
They're going to call. My insurance company assigned me to Dr. Brown, so I just need to see somebody in his office.
Yeah. Okay. So. Well, and once as people maybe after you've been on this show, people are going to know, oh, I can go see Kurt at Dr.
Right. See, we've been hopeful.
Then you may have a bigger.
A bigger following. And it's interesting though, because once I found out that some of our friends and some of Dora's customers goes, oh, he works at, I'll go there.
Yeah.
So that works. Well, the other thing is you want to feel comfortable with your primary care.
That makes it
because there's
a whole
just
lot
sometimes
easier to be able to talk about stuff.
Right. And it's like, okay, we have to do this. I don't like it, but okay.
Yeah.
Right. Okay, we'll just go on from there.
As long as it's you.
Right. There's a comfort factor there, because sometimes you're just not going to want to, I don't want to talk to him. Or to her, or to whoever the case may be. Yeah. But I feel comfortable, and that's good. That's a good thing.
Yeah, absolutely. So in between all this other stuff, I know you also have been known to help out at Dora's Deli.
I do. She keeps me busy. I mean, she's amazing, and I always thought I was a busy person, and then I married Dora.
Did you start taking extra vitamins at that point?
I do, and it's funny because. one day we did a wine dinner and I was doing the introductions and there was a ton of people in the room that didn't even know who I was, which is, I mean, I'm okay with that, but
Dora's husband, Kurt.
Right, Dora's husband, yeah. I refer to myself as Mr. Dora. Mr. Dora, and that
Marvin's done that in the past too.
Right, it works.
Yeah.
It works because then there's that association. Oh, right, okay, now I know who you are. Right. And I'm okay with that because it's such a great place.
Oh, it
and we
is.
have so much fun with it.
They do,
you know,
yeah.
so.
Awesome food,
Right.
good fellowship, good wine. Oh my goodness.
Yes.
Lots of fun things.
Yeah, lots of places. I mean,
And she
it's
feeds
just
my
fun.
chickens.
You're right, you know.
Yeah, that inside joke. Yeah.
Right.
Sorry.
So that's okay. You know, you got to have those once in a
Yeah,
while.
absolutely.
Because everybody else is going to wonder, what are they talking about?
Yeah, chickens. Who's got chickens?
Yeah.
Anyway, so back one more time to urgent care. If, like we talked about earlier, it's a great place for folks who either have a semi-emergency, right? Not necessarily that they need to go to the ER,
Right.
but they've got a sore throat or an earache or need a physical. You
Right.
talked about. You can get all that done at Fast Tracks.
Yes.
Either one of the locations.
Right. And you know, and Fast Tracks is, we open up at 8 o'clock every single morning.
Okay.
And the one on Stockton Hill closes at 8 o'clock at night.
Every
Night.
Wow.
Well, Saturday they close at 4, and on Sunday they close at
but
2.
Monday through Friday,
Monday
they're
through
open
Friday.
until 8 at night.
Right.
Oh,
And the one out in Golden Valley is, again, opens at 8 and closes at 6, Monday through
Okay.
Friday.
well, that's pretty convenient for the working folks too, who maybe get the call, you know, come pick up your kid, he's sick,
Right.
bring him in to you guys versus trying
And
to.
they're going to need a note from their doctor that said it's okay to go back.
Yeah.
And that's the other thing that we do. And that makes life easier for the moms or the
Exactly.
dads that said, okay, let me
be able
get
to go
them.
after work and
Right.
still get in to see the doctor, because most of the time our regular doctor's hours are the same as your business
Just hours. We were just talking about it a little bit ago about the availability. Oh, I got to go to the doctor. Well, I can't because I got to do it on my lunch hour, and so
Yeah.
does everybody else.
Yeah,
So
right.
you
So
can't
then
get
you
in.
really have to wait if you can only go
Right.
at that certain time, and it's really hard to get in to see
Yeah.
a physician.
And Fast Tracks provides that, and it's a first thing in the morning we're really busy, and then at lunchtime we're really busy, and then right between
after.
4 and 6 we're really busy.
Everybody's off
Right.
work quick.
Right.
It's him. We're home from
Exactly.
school. Get him in quick.
Yeah, so we can get back. So they can go back to school tomorrow because I got to be able to take them back to daycare or whatever the case may be.
Yeah,
So-
yeah, because the little ones too then. So I don't know their numbers off the top of my head. I should have done that. But the good thing is that they can go to our website,
Yes, they can.
azkmc.com. They can look up you,
Yes.
look up Kurt Manley under Find a Physician. You should be on there. And then Fast Tracks, all their numbers are posted on the website
They are.
as well. So do you know their numbers off
I
the
do.
top?
The Stockton
you're
Hill one,
good.
yeah. The Stockton Hill one is 753-3303.
Well, that's an easy line.
Right,
Now
exactly.
you can
Yeah.
remember that.
But that, yeah,
Okay.
that's where they did it, probably so I could remember it. And then the Golden Valley one is 718-5200.
Okay, very good.
That'd
Well,
be
both
great.
of those are pretty easy
Right.
numbers to, but do they don't need to call to make an appointment,
No
right?
appointments
you
are
just mostly
necessary.
walk-ins.
And they're walk-ins. And then they'll call and say, "Are you busy?" We're not right at this moment.
So come down quick.
Right? Yeah.
It could
If
change
you're out
in
in the
5
parking lot,
minutes.
now's a good time to come right in because it changes so fast. You never know from day to day or
Yeah.
hour to hour, minute to minute how it's 6 people walk in. It's like, oops.
Yeah.
Now I'm busy.
Right. Well, like in the ER, just not too long ago, we had that tour bus accident. They went from being
Nothing
quiet,
to boom.
boom,
Yeah.
all
Exactly.
at once. So you
Yeah,
just
then-
never know.
Exactly. So.
Yep. I usually call ahead of time if when I sprain my ankle, I call down to the ER because I just happen to be here, so
Right.
it's kind of more convenient for me.
Convenient, right.
But are you busy right now?
Right.
If you are, come back later.
Right, because it's really going to hurt now. It's going to hurt more later, but I'll be okay with it.
I could just sit here until
Right,
let me know
exactly.
when's a good time.
And Fast Track provides that too. That makes it. And the one at Stockton Hill, we do have X-ray capabilities. In some cases, are limited,
Yeah.
just because of from a credentialing and the technician that are advanced or basic depends upon.
Okay.
But we know we can do chest X-ray and ankle sprains and wrist
So I
sprains.
could have gone there to have my sprained ankle looked at.
Yeah,
Didn't
you
even
could've.
think about that. Duh.
Should have gone to the AZKRMC.
I should have gone to our website. Thanks, Kurt. I'll remember that next time.
Right. Yeah. I'm going to get all kinds of calls now.
It's too funny.
I know. So. Okay.
It's really important, though, for people to know that they can go to the website and find a physician.
Right. That's very true.
They can find their picture so they
Right.
know what they look like. So if they go in there, they'll know that's who it is.
Right.
But, so anyway, it's been great having you
Thank
on
you
the
very much
show.
for having me. I
appreciate
really
you
enjoyed
being
it.
Here. And, tell Dora hi for me.
I'll
and-
do that. I'll make sure she
Okay,
knows.
we'll be down at the next wine pairing, I'm sure. So, okay. Thanks for joining us today. I hope you'll join us again next week when I'll have another great guest. See you then.